Greetings, sorors. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. And I'm a co-founder and co-chair of the Black Maternal Health Caucus. I am delighted to be with you, my dear sorors, for this event. And I would like to greet all of the women of the Psi Epsilon Omega chapter of Alpha Kappa Alpha Sorority Incorporated who are organizing PEO days at the U.S. Capitol for 2021. This event continues a rich tradition of policy advocacy that is consistent with our mission of service to all mankind. As you begin your outreach to members of Congress, the virtual meetings that you will be participating in are a reminder of the pandemic that continues to impact our communities. And while nobody has been spared from the destruction of the coronavirus, COVID-19 has disproportionately impacted Black women and other people of color, particularly pregnant people. In fact, a recent study found that pregnant people with COVID-19 are 15 times more likely to die, 14 times more likely to be intubated, and 22 times more likely to have preterm birth than those who are uninfected. That's why it's so important to get vaccinated, to protect ourselves and the people we love. If you're pregnant, breastfeeding, or trying to get pregnant right now, or might become pregnant in the future, the Centers for Disease Control and Prevention recommends that you get vaccinated against COVID-19. So make sure your friends, family, and neighbors know the COVID-19 vaccine is safe, it's effective, and it's how we'll finally end this pandemic that has severely devastated our communities. Of course, the stark health and economic inequities that we've seen over the past year and a half long predated the spread of this virus. So when this public health emergency ends, we can't afford to go back to what was broken. Sorors, it's time to build back better and ensure that every person can be healthy and thrive. In Congress, I'm particularly focused on addressing our nation's maternal mortality crisis and the stark disparities facing Black women and other birthing people of color. Black mothers in the United States are 3 to 4 times more likely to die from pregnancy-related complications than white mothers, and Native, Hispanic, and Asian American people also experience higher rates of maternal mortality and morbidity. To tackle this urgent crisis, I am proud to be the lead sponsor of the Black Maternal Health Momnibus Act, which I first introduced with our SOAR, Vice President Kamala Harris, when she was in the Senate, and reintroduced earlier this year with Senator Cory Booker, Congresswoman Alma Adams, and now more than 180 co-sponsors in the House and Senate. The Momnibus includes 12 bills that build on existing legislation to comprehensively address every driver of maternal mortality, morbidity, and disparities in the United States. We know that we can't address issues like maternal health without an intersectional lens, considering both clinical and non-clinical factors that influence outcomes. That's why the Momnibus includes key investments to ensure that every birthing person has access to high-quality, culturally appropriate maternity care, from funding to grow and diversify the perinatal workforce to trainings on implicit bias and racism for healthcare professionals. The Momnibus also includes policies to address social determinants of health, from housing to nutrition to environmental conditions like extreme heat and air pollution. The legislation emphasizes the need to provide funding directly to community-based organizations that are on the ground, doing the work, ensuring that Black women and birthing people of color receive the care and support they need and deserve. Since introducing the Momnibus, we've seen significant progress in advancing these priorities. One bill in the legislative package, the Protecting Moms Who Served Act, passed the House with unanimous bipartisan support, and other bills have already passed in committees. Now, we need your continued advocacy to ensure that this legislation gets to the president's desk to be signed into law. Together, we can take the bold action that will be required to save moms' lives and racial and ethnic disparities in maternal health outcomes and achieve true equity for birthing people of color, including Black women. Sorors, thank you for your commitment to this mission, and thank you again for the opportunity to join you today. I look forward to the day that we're back together again in person, but until then, take good care of yourselves.